Hello, everyone. This is question 39 of our 100 clinically oriented anatomy questions. So let's jump straight into it. The question says, when he attempted to lift one side of his new electric automobile from the ground to demonstrate his strength, the 51-year-old male felt a sharp pain in his back and quickly dropped the vehicle. Upon examination, it is observed that the patient has deficits in sensation on the dorsum and sole of his foot and marked weakness in adduction and lateral rotation of the lower limb. What was the nature of his injury? A. Piriformis syndrome with entrapment of the sciatic nerve. B. Disc lesion at L3, L4. Disc lesion at L4, L5. Disc lesion at L5S1. Posterior hip dislocation. So the major thing that the question pointed out that we need to solve the question are what I've underlined here. So there is a loss of sensation on the dorsum and sole of the foot, and then there's a weakness in abduction and lateral rotation of the lower limb. So the first part is cutaneous innervation, and the second part is um, myotome. Basically, first is dermatome, the second is myotome. Understanding of dermatome is actually enough to solve this question. Okay, so let's discuss the options one after the other. Piriformis syndrome with entrapment of the sciatic nerve. So piriformis syndrome occurs as the doorway to the gluteal region. That's at the greater sciatic foramen. You have entrapment of the sciatic nerve, and then it affects all the muscles supplied by the sciatic nerve, the hamstring muscles, the anterior, posterior, and the lateral compartment of the leg muscles. So those are basically the things that will be affected, and that is definitely not the case here. This lesion at L3, L4 is going to affect the L4 nerve. This lesion at L4, L5 nerve is going to affect the L5 nerve. This lesion at L5, S1 is going to affect the S1 nerve. And the posterior dislocation is basically the dislocation of the femoral head from the acetabulum, and that's clearly not the case. So we have three options that we should be considering. This lesion at L3, L4, L4, L5, L5, S1. So in option B, we have the entrapment of the L4 or the compression of the L4. In option C, we have compression of L5 and we have compression of S1 here. So L4 basically supplies it gives cutaneous innervation to the skin on the medial side of the leg, and then medial side of the leg and the medial border of the dorsum of the foot. Basically, that is what L4. Those are the skin that the L4 supplies, and I don't think that's what the question says here. It says skin on the dorsum and sole of the foot, so that is clearly not the correct answer. Option C, this lesion at L4, L5, that is compression of the L5 nerve. L5 nerve supplies the anterior portion of the leg, gives cutaneous innervation to the dorsum of the foot, and together with the S1 nerves gives cutaneous innervation to the sole of the foot also. So I think that is going to be the correct answer. But let's check S1. So what does S1 supply? The S1 uh, supplies the sole of the foot, supplies the lateral border of the dorsum. Basically, that's what it does. So the correct answer is L5. Let's check this image. So this is an image that gives the cutaneous innervation of the lower limb. So like I mentioned, L4 supplies the medial part of the leg, the medial border of the leg basically. Also supplies the medial border of the sole, also of the dorsum of the foot. L5 supplies the anterior lateral portion of the leg and supplies the dorsum of the foot. Alright, supplies the dorsum of the foot. So it's actually the L5 that was affected in that question. So the correct answer is option C. So option C is our correct answer. So let's check the other ones. S1 supplies the sole of the foot, like I mentioned, and supplies the lateral border of the dorsum of the foot, and that's not clear. That is clearly not the correct answer. So that's the option. The correct answer is option C. But let's check the myotomes. Weakness in abduction and lateral rotation of the lower limb. Lateral rotation is actually controlled by the L5S1 nerve. Abduction is also controlled by the L5S1 nerve. So L5S1 nerve predominantly by the L5, right? Predominantly by the L5. So that's corroborates our answer. So the correct answer is option C. I believe you understand and you enjoyed the video, and I will see you in the next episode. Thank you.